Good evening, everyone. Can everyone hear me okay?
Yes, we can.
Thank you. Thanks for joining. The objective of this meeting is to introduce the Convene telehealth workflows. We do ask team that you hold your questions until the end of the presentation. Feel free to ask questions via the Skype chat, but we really encourage you to ask as many questions as possible when we get to that point. Going forward, support for Convene workflows will be handled by Ambulatory Informatics at the 231-392-0229 number. Your practice managers and super users, they're very familiar with this number, so please reach out to them if you need to. For billing questions, you would contact Lori Wilden directly via email. This meeting will be recorded and posted on the EHR site. Important thing to note is that Convene is only used for audio and video as that conduit between the provider practice and the patient. We will continue to schedule appointments, do clinical documentation, and bill out of Cerner or ECW. Our presenters for today will be Rebecca, Jessica, Kelly, Chelsea, Chris, Lori, and Ellen. Chris will kind of walk us through the technical requirements today, and then we'll actually move into Convene settings. Then we will look at the workflow, and then Lori might touch on some things around billing. So with that said, I will turn it over for introduction from Ellen or Chelsea.
Well, hi, this is Ellen. Oh, I'll get started, and then Chelsea, you can introduce yourself. But this is Ellen Smith, Chief Operating Officer for the Physician Network, and want to welcome you to the education session today. We're excited that we're able to roll this technology platform out to really assist, and our primary goal is to provide better access for patients given our current circumstances and the COVID-19 pandemic, while at the same time supporting our providers and practice staff by providing that conduit and a safe environment to provide that care. So we started, of course, with telephone visits a week or so ago, maybe 2 weeks now. Everything's gone by so quickly, and now have quickly moved into the capabilities that we're rolling out today around video and audio options as well. So we'll be adding that to our virtual interactions with patients, and look forward to the discussion and questions so far. We've had good engagement, and we look forward to rolling this out. It will be a very quick rollout over the course of this next week or so. So those of you who are super users that are involved will be very critical in this process, and we're making sure that we provide the support and resources to have a successful launch at each of the practices, so please don't hesitate to reach out to any of us on the project team, as we know there'll be hiccups along the way with this sort of a rapid rollout, but we really want to get these tools in your hands so that, again, you can provide access for patients in a safe environment. So, Chelsea, do you want to introduce yourself real quickly?
Sure. For those of you I haven't met, my name is Chelsea Shafransky. I'm the new System Director over Digital Health, and have been working with Ellen and the team on getting Convene up and running.
Okay, thank you. So we'll go ahead and get started with Chris Kitchen.
All right. Hi. For those of you that don't know me, my name is Chris Kitchen. I'm in the information technology area for Munson Healthcare. I'm our enterprise architect and have been assisting the team with the technology and application side of Convene. We're going to cover some, I'm sharing my screen. You should screen now. We're going to cover some of the technical requirements for the use of this, and then I'm going to go through and display to you a demo of both the provider and patient perspective for using Convene. As most of you know, this is a third-party web-based telehealth solution, and we're using this strictly for the video and audio aspects of it. It can do more than what we're going to leverage at this point in time, but it will provide a mechanism, a relatively easy, lightweight mechanism for us to have video and audio connections. It is not connected to our network per se. It is not something that's connected to any of our EHRs for data to flow between. We are just using this to do the video and audio. You will continue to do your workflow from within your EHR for the visit, for the documentation, results review, and subsequent downstream billing and whatnot. The provider experience for using CareConvene is an app or Google Chrome. Google Chrome can be used on just about any device. Only the provider has the ability to use Google Chrome. I'll get into the patient in a minute. The CareConvene provider app is available in both the iOS and Android app store, so it can be used with an iPad or iPhone or any Android tablet that's out there. This is within the iOS App Store. There's it's CareConvene Provider. When you search for CareConvene, you're going to get two apps that show up, the patient and the provider. The icons are very similar, but the provider is a darker blue. The patient experience is strictly in an app on a smartphone or a smart tablet. And they would use the CareConvene patient. It does not allow the patient to use a browser, which is helpful from the regard of troubleshooting and a number of issues that can happen with PCs and laptops and their connections and how their devices are managed. So that's probably they chose that direction for probably the best patient experience, but that does come with some requirements. You need to have an Android or iOS device. The app is pretty forgiving as far as how old your equipment is. It will support iOS version 10 and Android version 4.4, so that covers a lot of those devices that are several years old. From a hardware standpoint, if you're using an iOS or Android device, the camera, the microphone, and the speakers are all embedded and designed to work natively. As you put in new apps, you just might have to select yes on the permissions. From a PC or Mac laptop, you can leverage an integrated camera and an internal microphone and speakers with the Google Chrome web browser for the provider experience. And in our testing, that has worked well. If you're using a desktop, you may need to use an external camera or a headset for that video and audio because those traditional PCs are a little bit harder when it comes to audio. Connection is probably the biggest factor we're going to deal with in Northern Michigan. We need at least a 50 meg connection. So that means if you're on Charter Spectrum or cellular LTE service by any of the providers, that should be adequate in the vast majority of cases. For those of you or those patients that don't have a good internet connection or they don't have LTE service, they're in a kind of a zone that has only 3G, that isn't going to be sufficient, and you might see some delays in the video and the audio or some freezing. And it's important to remember that this goes both ways. So you may have a great internet connection at home, but the patient is in a bad area where they don't have a connection. So we have to keep that in mind and be able to adjust. If you're having a bad connection, your probably best route is to go to a telephone visit and figure out what the next steps would be. So I just wanted to make note of that. As far as I'm going to show mostly the Chrome access just because it appears better on the screen, but also show the patient experience. The provider would go to careconvene.com, or if you're given a link, right directly to the login page, but careconvene.com will bring you to the right spot. You click on physicians, go to log in the physician dashboard. Here you will enter the credentials that you were provided. And when I log in, I immediately go to the tracking board view. You know that this is me and I'm available. I can be made unavailable and it will show up as, I won't show up as an option to connect with. So it's important to make sure that you show as available. From the patient experience side, when they download the app, they fill out some information to register. And I went a little probably above and beyond here, just assessing the app of adding a picture and others. But at the bottom here from my home view, in the middle, you will see a visit icon that's dithered. If I click on that, that opens me up to a page where I can initiate a visit. So I was given a provider code. And so I went in here and put in that provider code, and that allowed me to have our test site here that I'm going to use right now. So this Munson Healthcare Grayling Hospital, I would tap to begin. It's going to ask me who the visit's for because I didn't register any dependents in here. It just shows up as myself. When I enter in here, it now gives me for this location the provider to choose, and you can see that I know I have a scheduled appointment with Chris Kitchen, so I'm going to click on that. It's asking if I want it now or later. I want it now. This was a scheduled visit for us to meet in 15 minutes or so, and then the reason for visit is a scheduled office visit. At this point, I could put in I could put in additional details if I chose. We're not asking patients to do that, but it's always possible somebody might put something in or take a picture of something. And I'm just going to do that so you can see where, if that happened, where you would see that. And then down here, I can click to see if view the consent notice of privacy, or I can just go here and request a visit. And I'm saying, yes, I'd like to do a visit. So this puts me into a waiting room as the patient, and I will now appear automatically on the provider's tracking board. So you can see Christopher Kitchen for a scheduled office visit for Chris Kitchen. If that doesn't show up right away, I can always hit the refresh button to reload the page, but I'm finding within about 3 to 5 seconds these are appearing. As a provider, I would click on the patient's name. This would give me some information about the patient depending on what was put in during the registration process. I did fill in some additional details when I did it, just so you could see how it looks if that's the case. The comments that I put in on that one screen would appear here. The photograph appears over here in the chatbot window that I took. So that's where you would see those. At this point, the visit isn't started. This is just me as a provider going in and looking at any information. As I mentioned, this app has a lot of flexibility as far as how we would use it, so we're not using any of this. So the SOAP note and these different tabs down here we can ignore for now, since you're going to be working in your EHR. We're just worried about having a connection with the patient. So I click start. It wants me to confirm that I'm ready to start that visit. On the patient side, I get an update, even if I have that app closed at this point because I'm playing a game or on Facebook. I would get an alert on my phone, just like any other alert, saying that there was a status update in the app. And when I click on it, it would bring me here. I can click OK. At this point, I'm connected with that visit, but the audio and video isn't connected at this time. What's opening up on my app is a chat bot, and that would be similar to what this window is. So we could type to each other information through this chat bot. If we're having any problems or for some reason the connection doesn't work, that we're going to do in a minute here, so you can see that there's a way to communicate back and forth with a real-time chat. To start the video and audio, up here in video chat, the provider would click there. It's going to notify the patient to accept or decline, but right now I'm going to accept. And at this point, my video is on, but it's black here until the provider connects. Once the patient accepts this, it notifies you and then asks you whether you want the current window or a new window to show this interface. It doesn't matter which you choose. Either one will get you to the right place. So now we're connected, and so you can see me as the patient here, and then me as the provider down here on the patient side. It's just flipped around. So, of course, I have backlighting here from my backyard, so it's making the picture a little bit dark. But as you can tell, I'm waving my hand and my fingers, and you can see the quality and timing of it is very good. At the point that I want to, the provider would disconnect the session. You can hang up with the red button down here in the telephone receiver. That ends the video chat, but I'm still in an active visit right now. It's like where we started, the chat bot is active. So to end visit, I would go here, click end visit. From the provider perspective, I just want to show really quick the app because it is being used. So this is the provider app, so you can see there's a visit in progress. I can come in here and you see I just switched from my computer to my phone at this point. So you see what chat was done. I can click on the camera here, and then this will connect me, and I just got a notification, so I'll accept that. And now, looks like I disconnected it by accident. Sorry about that. That's my fault. I'm trying to do two things on one phone. Yeah, and what it's doing is that I can't do that because it's competing for the camera. I just realized. But anyway, that on the provider side, you're getting that same view. The only thing to consider is with this, there are things to get to that pre-assessment page that I was looking at. You have to go up to the stack of pancakes up in the corner here. So that would get me to this page, but otherwise you'll go right into the bot, and the camera will allow you in the lower right hand corner will allow you to start the audio and video it. So once we're I'm just gonna do this. Once we are done here, let me disconnect. I go in, I end the visit, say yes. Visit is ended, and then I go back to my main screen, and the user will also get a notification on their end that the visit was ended. So now I'm right back to my tracking board and ready for the next patient.
Thanks, Chris. Okay, we will move to Bianca.
Hi, everybody. My name is Bianca Robledo. I am a practice manager in the Grayling Physician Network. I will just be going through the workflow that we're utilizing here in the Grayling Network. And my computer's frozen, excuse me. Can you guys hear me still?
We can still hear you. Jess or anyone if you could you try to pull that up and Bianca can still talk to it? Does anyone else have that available to share?
I'm working on pulling it up right now.
I think we might be okay.
Okay. Looks like you're unfrozen.
Okay. So I'm just going to be going through the workflow that we're utilizing right now in the Grayling Physician Network, and also current job aid that other practices can utilize for the Cerner program. So right now we ask that a patient has a smartphone or a tablet because it is only compatible from the patient side with a smartphone or a tablet. So when the patient initially contacts the office and requests a visit, or the clinical team or the medical receptionist realize that the patient can be seen for a video visit, we would ask them if they have a smartphone or a tablet. There is a list of diagnoses that has been used for like a most frequently seen, but that's not something that we're going off of with this pandemic going on right now. We are seeing patients for a variety of reasons. So when the patient's scheduled, we would schedule the patient as a video visit in the appointment type within RevCycle. And in the comments, we would add a reason for the visit. So if it was cough or headache. And then we would just share with the patient the provider code, and then let the patient know when their confirmed appointment date is, who they'll be seeing, what time it is. And then we're going to encourage the patient to download the Care Convene patient app from the iOS or Google Play stores. And then, of course, remind the patient that the video visit is a billed visit with the provider. And then getting that contact number to reach the patient at for the check-in process. So the day of the appointment, the medical receptionist would contact the patient about 15 to 20 minutes before the scheduled appointment and continue with the normal check-in process through RevCycle. Once that check-in is completed, the call will be transferred to the appropriate clinical team member. For the clinical teams, the day before the appointments, we are asking them to complete a chart prep still. And included in this chart prep would be contacting the patient and ensuring that they have downloaded the correct app, that they will be prepared for their appointment by having a strong internet connection, making sure their device is fully charged at the time of the appointment, and then allowing 15 to 20 minutes before their scheduled appointment to receive the call to get checked in. The day of the appointment, the patient will be transferred to the clinical team, and the clinical team will open up the patient by the intake power form. In the HPI section, the clinical team will need to document the consent for the video visit. And this is important to document in that HPI section, and then they'll just complete that remaining intake. Once that's completed, then the clinical team can notify the provider, whichever way is best for them to communicate, whether it's a text, a call to their cell phone, but the clinical team will contact the provider, and the provider will also get a notification on their cell phone via text, or if they have the app, they'll get a notification through the app as well. So they can log in on Google Chrome log into Care Convene through Google Chrome or on the Care Convene provider app, and then they'll see that patient in the tracking board where Chris had showed you. Once the patient has been completed with the clinical team, the provider can get in there and start the visit and initiate the video chat. Only the provider can initiate the video chat. The patients cannot. So they're going to review the patient visit within the ambulatory workflow as normal. And then to enter in that video consent that the clinical staff had documented, there are some dot phrases that are included in this job aid. And then the orders can be entered by the Quick Orders tab. And there are the E&M codes that are available to select. When the visit's complete, the provider will complete the visit in Care Convene and select the video visit note type found within PowerChart, finish the document and sign it. And Jessica, did you want to go ahead and show them that workflow, and then I can show them the settings in Care Convene?
Just give me 1 second to present my screen. Okay, everybody should be seeing my revenue cycle open.
Yep.
I just wanted to point out that we did we did create appointment types for telehealth videos, including video visits. So if I just type in VI and hit enter, bam, video visit is available for scheduling. This will help you pick out which appointments are video visits and which appointments are telephone visits. So the workflow in PowerChart is really very, very simple. It's the same provider workflow that you're accustomed to doing. You'll go to the ambulatory organizer, find your appointment, click on and then you'll be taken here to the ambulatory workflow. Now, if you are in a healthcare team where the clinical assistant is doing the intake process for you and they're documenting the HPI, you can use your HPI intake template to pull that information that was done by the nurse into your note. And specifically what I'm talking about is it's important to document that you obtained consent for this visit from the patient. So I took a screenshot. Your clinical staff will go ahead and do their normal intake. And unfortunately, this does not work in a power form, so they will have to just free type in that the patient consented to the video visit. However, what it does for the provider is it allows them to come in here and go .pc_intake. Whoops, type something wrong. And if you're already in a work group where you're utilizing this HPI intake, then you would just go ahead and select that one. What was put in the intake form on the power form is automatically pulled in here. If you do not have your nurse or clinical staff member do that intake for you, you can get that consent by going .pc_, and you see that there's an HPI video patient and other, and an HPI video patient only. So if you're just speaking with patient, you can just go ahead and click this one right here, and it pops in that auto text sentence for you. If you're doing both, say you're doing it with and their child, one thing that's nice about these auto text templates is if you click F3, it will bounce you down to any underscore, and that way you can quickly put in, say, mom, and put a name in there. So any time you see an auto text, that little underscore, that F3 button will go ahead and launch you to that underscore and allow you to free type in there. So you just go ahead and document your visit as normal. And the thing that's different is instead of using ENCODE to submit your charges, you are going to submit charges from the primary care orders or your quick order page. And to do that, we've gone ahead and built in a video visit section on the other E&M visits component on the quick orders page. You'll see there's telephone calls and video visits. You just simply select the video visit that you want to bill for and submit that through your orders for signature. Once you're done with that, you'll navigate back to the ambulatory workflow, and we've created a video visit note for this documentation. So you'll go here to where it says More, select Video Visit, and that will create the video visit. Now, it's got sections in the document. The first one here is the video visit statement. So if you've used Convene to complete this video visit, there's no need to change the sentence. It just simply tells you that this was completed using a HIPAA-compliant application, which is Convene. It is important to document time for these. So again, I go ahead and hit F3. I can go and say, oh, this was a 20-minute visit, and document that time in there, finish my documentation, and then simply sign my note. When we sign this, notice that ENCODE does not populate, and it doesn't need to because we've already gone ahead and submitted our charges from primary care orders. And that is a demonstration of the workflow in Cerner.
So I can go ahead and show you all the settings for when you get your logins through Convene. This will just show you it's right here, how to edit your contact number. I'll go through it all with you guys. So if you click on your name and then select edit profile, you can go in here and update your phone number. So this could be the best contact number to text you when you have a patient in your waiting room. Our visit fee right now is going to be set to 0. This will be blanked out for most of you, so you cannot change it. But if you can and it's not 0, we want to make sure that is at 0 at this time. For the visit types allowed, we want appointment and on-demand visits. We do want the SMS alerts for my patient visits to be yes. Down here, this is saying that you will be on call. You'll get notifications for every patient who checks in under your care team, unless you turn this off. So notice how right here I just became available. This is for, like, I'll get notifications for everybody that checks in. So I don't want them to turn that off. And then we're going to have no and no on these two options. And this is where you'll change your password. So it will be more standard for you. There is a provider code here, but we are asking that you guys use the provider code that's given for your care team rather than your individual provider codes. Up here, this is where you can change your availability. So at the beginning of the workday, we ask you to change it to available. And then at the end, you can come up here and change it to unavailable. This is just taking you offline, basically, so no one can request a visit with you. You won't be available to get visits. And then you would just go back to your tracking board to watch who's checking in. Lori, did you want to continue with the billing portion?
Sure. This is Lori Wilden, the System Director for Professional Billing. The one thing I'll just say is Jess showed you how to find the E&M codes. You're going to bill your same E&M code you bill now. Mostly you'll have established patient visits. Most of the payers have lifted the requirement, though, that you can do a new patient visit. But I will say, in order to, meet the criteria for new patient visit, you have to be able to do a physical exam, which sometimes is possible via video, perhaps if the patient had a rash or something like that. But many times you won't be able to, and in that case, just bill an established code because you'd only need 2 of the 3 bullet points. And I don't know if anyone else has any questions on billing. Okay, and feel free to email me if you do have any.
Thanks, Lori. So we are open for questions now. Please ask as many questions as possible while we have this team of subject matter experts together. We will try to answer any and all questions. Was the presentation that good?
Yeah. This is Terrell. Yes, it was a very
lose connection.
Yes, very good presentation. I'm sure I'm going to have a lot more questions as we go. I have some more meetings tomorrow with regarding the telehealth and the use of their carts. Real presence, so may have some more questions there.
Yeah, this is Chelsea. Please feel free to reach out with questions. I know we've had a couple of technical questions or issues as providers are starting to use this, so we are suggesting to do a test video visit in your office before doing a live visit with the patient. Each of you can download the patient app and access patients with your providers. And then if you do run into technical issues, please call. I guess for the next couple of days, let me and Chris Kitchen know. And then I think later this week, the IT help desk and our clinical informatics team are helpful. Just make sure you're letting one of us know so that we can help troubleshoot with you and make sure there's not a larger issue that we need to resolve.
Another thing that, this is Bianca, that I wanted to encourage teams to do is looking forward at your schedules for the next couple of weeks and seeing, like with the next 2 to 4 weeks, and seeing who can be moved to a video visit. With the low volumes, we found that this is helping to get patients in and get them seen in a timely manner. And we're also able to bill as a normal visit. So it really does help looking forward and trying to fill those spots.
Okay, Ellen, Chelsea, anything else you wanted to share?
The only thing I've ended with usually is make sure you test this out, trial it out once you get your logins. If someone hasn't said this before, and maybe I missed it, but I would say, do some test patients. One of you in the practice pretend to be a patient, and the other work with a provider, a super user with a provider, and walk through it. As Chelsea mentioned, there have been some technical questions or issues that have come up, so we want to be sure that we learn about those quickly and help you to address them. So a soft launch, as Bianca often calls it, is a good idea as you're getting used to the platform.
This is Michelle Spalding with Clinical Informatics and Cadillac. This question may be more for Chris Kitchen or maybe some education type thing, but how does this work with like the ED, or I see that Carrie Vaughn is on. I'm not sure if the urgent care in Traverse City is doing this too. Is it the same workflow or steps in the process to actually have that kind of care convene within like the urgent care or the ED?
Yeah, that's a great question. This is Chelsea. We're just starting to work on that. I'm actually sending a few emails right now to this project group. We've really been focused on practice implementation at this point. We are starting to think about rolling this out in the ED, so we'll be working on that in the next couple of days, finalizing that. I think it'll be a similar workflow of what we went through here from the care convene perspective, where the patient's downloading it either in their car or in a designated area of the ED, and then the providers will have it available somewhere within the ED to connect with the patient, but that we're still working through that.
Okay, thank you.
Okay, thanks everyone. Have a good evening.